Hello and welcome to episode 3 of Medical Today with me, Gerard Ratnam. This is season 3.0 and in episode 3, a lot awaits you. Well, before we get into anything else, the other day we had the honor and the pleasure of speaking to friends from the industry of eyeglasses, and we spoke to an optometrist, Dr. Woon Seong, who is the president for the Association of Malaysian Optometrists, and also Chong Lee, commercial development manager for Hoya Lens Malaysia, Sdn Bhd. They talked at length about eye strain and the development of technology with regards to eyeglasses these days. So here's that interview. Let's take a look at it and come back right here on Medical Day. Woon and Zili, thank you very much for joining us on Medical Today. Well, a lot to talk about with regards to the eyes, but I was going through an article the other day, and the article says that by 2020, that's next year, there'll be 20 billion devices out in the market. I mean, from where we were to where we are now, we are being consumed by devices. We are not using the devices, but we are slowly and surely being consumed by these devices. Now, when you look at the younger generation, here's the story I have with regards to the younger generation. I was at the restaurant the other day, and the mother's trying to eat. She has a kid here. So to keep the kid quiet, she puts on a cartoon for her on the phone. And the device is in front of the kid's eyes here. And how is this not dangerous to the eyes? Zili, maybe you want to start?
All right. So actually, digital devices that we are using, they're usually made by LCD or LED screens. So for the screen, actually they emit blue lights, and also for kids, when they read so near or they watch the cartoon so near.
This is not near. This is really too close, I think.
Yeah. When there's too close, they will actually make their eyes strain. So we call this symptom digital eye strain. Yep.
Right. So digital eye strain is now that's the latest buzzword. Yes. It is soon going to become a debilitating disease if nothing is being done about it. As a trained optometrist, I think the bigger thing here is to bring about awareness with regards to what you need to do to protect your eyes. What do you do in your area of practice?
As we know that both our eyes are exactly like cameras. They are designed to see from far to near. But when we look at something that's near, we're looking at certain distances for too long a time. So what would happen is people will get an eye strain, they will get eyes turn blur, and they will have a problem from looking from near to far again. They get flashes of light, that means their eyes are sensitive to light.
Right, some people see floaters. Why is that?
Yeah, floaters is not so much a cause of digital eye strain. It's just because that the light, what they call it, hits on things that's inside the eye. So that's a cause for floaters.
Right. So, basically, if we look at the eye, inside and outside, how is it working, focusing? What does it do? Does it contract, or what happens when it looks near and then looks far? Is there something that's happening there?
Right, so inside the eye there is a natural lens, and what's different from this lens compared to a camera lens is that these lenses can actually thin and it becomes thicker through the pulling of the muscles. So what happens is when we focus too near for too long, just imagine if we are carrying something for too long.
Right, so it's like holding a weight for a long time. Exactly. Right. So when you look further away, it sort of relaxes the muscle. So this is something we need to keep in our minds all the time.
The second thing would be when you look at something for too long, you tend to blink less. And when you blink less, you have the other issue of dry eyes.
Right.
Yeah, so you have these two combo.
Right. It was interesting, you talked about two different kinds of screens. Okay, there are, can we go through that again?
Yeah, usually they're made by LCD or LED screen.
Is there a difference?
Basically, they are just different material. But if you ask a technical expert, they will tell you LED will be brighter, they give you better contrast. But basically, phones, because there are many phones in the market, so basically they are just made by these two type of material.
Right. Now phones, maybe before we come back to what we're talking about, let's talk about phones for a while, because most of us use a phone now, and phones, they've got light settings for it. Are these light settings helping?
Oh yes, it does.
It does?
It does.
Yeah, right. So is it helping with your industry? So when someone comes to see you and you check them and say, hey, your eyes are not very good, you need to do something about the way you look at your phone, and do you talk about the light of the phone too?
Yes, we do. Then we would tell them that some of these phones would have a mode, a blue light filter mode even, so that would set the light at the correct level. That's more soothing for the eyes.
I think the bigger challenge is at this point is for people like Zili, because you come from a lens manufacturer's point of view, and coming from a lens manufacturer, I guess the challenge at this point is the younger generation and how you deal with the problems that they are facing at this point, because most of them grow up with devices, and by the time they're 18, 19, I'm sure they'll already have trouble with their eyes. What kind of statistics, what kind of numbers you have, when you manufacture something with regards to the younger generation?
So maybe if we look at the statistic that we can get from the internet, from any journal, we found that actually most of the people, we are using digital devices or we're facing screens about 8 to 10 hours every day. And basically for digital eye strain, we can start to feel the eye strain is just like less than 2 hours or maybe 2 hours of continuous using digital device.
So after 2 hours of continuously using something, the eye strain sets in.
Yep. And some people, even if they are more sensitive, even lesser than two hours, they already start to feel the eye strain.
Right.
Yeah. So as now we know that we can't stop people using digital devices because it's a norm, it's their lifestyle now. So for lens manufacturer side, we come up with a lens that help them to support their eyes when they look at near things like digital devices.
Okay, so if you talk about lenses now, talk about technology, top dollar, the top range technology is what in the world right now?
I mean for this digital devices, okay, it will be like our company, they come out with an anti-fatigue lens, which is targeted for people who below 40 years old, which deal a lot with digital devices.
We don't qualify.
Okay. So that lens is actually specially designed for all those people who use our digital devices.
So below 40?
Yep.
And what's anti-fatigue supposed to do? And what's the philosophy behind making this lens?
Like just now Mr. Woon mentioned, when we look at something near, actually we are strain our muscle at near so that we can see clearer. But this activity is just like use your muscle, you're holding something very heavy. So for that lens, actually the bottom part of the lens, they come with some supportive power to help our eyes focus at near so that we don't strain our eyes so much.
So how would you further simplify this explanation?
How will we simplify this explanation? Okay.
Using the muscle analogy.
Yeah. So basically, the top part of the lenses is for distance. And what happens is, let's say the strength of power is so much. So what happens is the bottom part of the lenses is lesser in power. So it relaxes the eyes.
So what's the difference from what you're saying and the glasses I'm wearing? So I'm wearing a multifocals, okay? So when I look down, my power is difference higher.
Correct.
Yeah.
So typically these lenses, the reading part will be lower as compared to a multifocal, but they are specially designed with special coatings for the younger generation.
Specially designed with special coatings for the younger generation. Now, when I first started putting on a multifocal lens, my problem was perception of depth, so on and so forth. It took me a while, like it does with all of us, to get used to depth and distance, so on and so forth. And then you get used to it. And then, as you progress, you find out, because I'm in front of devices all the time and I'm reading all the time, I find out that the lenses start to have black spots, you know. So that's where technology of lens varies from the cheaper and the more expensive lenses. So because I think now when people walk into an optometrist, and if the optometrist is not a trained optometrist, and there are a lot of them out there, you know, they can't tell you the difference between these lenses. They say, this one, you pay more, you get a better lens, but people don't know why they're getting a better lens. So a lot of people think they're being ripped off. What are your thoughts on this?
So there are many types of lenses. So the good part of it would be if the progressive that you're wearing, as well as the anti-fatigue lenses, now they each have a laser marking denoting what type of lenses it is. So you won't get ripped off. So you can take the exact same pair of glasses and go to any optometry. They will be able to verify what type of lenses you get. Yeah, so you won't be ripped off that way.
Right. Now, so also having said that, picking the lenses for you, is that done by you, or should that be recommended by the optometrist? You know, when as a lens maker, when you push your product out to various optometrists, do you give them a set of rules? Okay, if you're going to recommend these range of lenses, this is what you need to ensure your people know.
Yeah. So this one, as a lens manufacturer, we always feel that actually a qualified or trained optometrist, they should be the one who recommend the correct lens to the customer, because they knew the patient history, the patient complaints, what their eyes problem is. Then with that, they can link to the correct product. So for lens manufacturer side, we will like briefing or let our partners know, which is optometrists, to know what is the design and what is the benefit, and they can target to which type of patient.
Right. But are you also taking feedback? Say, you go to people like Woon or people under him and say, hey, give us some feedback about what people are saying about the lenses. Do you take feedback before you create a new lens?
Yes, but it's not at this level, because like our company, they had a lens technology center way in Japan, so they take feedback from that. And on and off, they will do some research or some survey on different country in different country.
Right. Is it hard to diagnose digital eye strain now? You know, a worried mother brings her son or daughter and says, oh, Woon, you know, my daughter, my son, you know, he can't see, he can't read really well. Do you straight off the bat know what's happening?
Okay. No, we have to go through the whole comprehensive eye examination, and to see, we will test whether the person really has digital eye strain. Some don't. And some will see, we will demo to them. We have trial lenses where we fit it right in from the...
Okay, hang on. You're saying that some people can be using devices all day long, but they don't have eye strain?
Yes, they do.
Or maybe we should say they have eye strain, but they're not realized on that. They don't know. Maybe they feel some symptom like eye strain or headache, but they didn't link it to digital eye strain.
So this is where we will jump in, where, you know, everyone, we will test them, every one of them, and see whether they have digital eye strain or not. You'll be surprised that some of them don't have. Some of them have it and don't know that they have it. So this is where, when we test for them, we put in the trial lenses for them, and they will say, wow, okay, this is, much better. Right. Then we will be...
And every time we talk about digital eye strain or just going to the optometrist, I think I want to bring this up again, that there are trained optometrists and there are people who just work as opticians. Now, you know, going to a trained optometrist is very, very important in this day and age, you know, with all the problems that we're facing, and the eyes being one of the most used senses within our body. It's very important that we make sure we know what we're doing with regards to it, because, you know, there are contact lenses that are being sold by people who are not even optometrists, and this has become a very dangerous thing.
So this is where I jump in as the president of the Association of Malaysian Optometrists. Yes, I was just waiting for the cue. So two things you can do. Number one is to go to the Association of Malaysian Optometrists website. We have an option there where you can find the optometrist that's nearest to you. So you go to the website and key in your location and find the optometrist nearest to you. Failing which, if you go to any store, you can also check and ask for their certs as well. So in their green certs, you will have their name, their IC number, and where they're practicing, and check whether that's a qualified.
Right. There are also some, I don't know if there are myths that need to be busted, but a lot of people come from overseas and say, oh no, they come here to make their glasses, but they say, you know, in overseas, in Europe and in Australia and in America, they have better optometrists. Is that the truth, or is that a myth? Okay. You know, yeah.
So in Malaysia, we are, ironically, you know, most people do not know that our levels of optometry is actually very high. I just came back from the Korean Association International Optometry Conference, and we rank pretty much up there in terms of our services.
Right. Yeah. So when it comes to you know, like lens manufacturers and you know all these companies that are suppliers to you all, when it comes to feedback, I think Southeast Asia is a huge market. You know, do they take data from you guys?
This is where we're gonna ask Zili.
Yeah, but he said like the company he works with is a Japanese company, and a lot of research is done there. But I'm sure data is taken from all over Asia.
Yes, actually data is taken all over the world. Because what happens is some lenses, in fact, there are certain lenses that are more that's better for Asians and not as good for the Europeans. So they will have two type of lenses.
Okay, so lenses also discriminates. So which means you have some lenses that are suitable for Europeans and some lenses that are suitable for us Asians.
Correct. Yeah. Principally because our face is different, nose size is different,
right,
and the way we use our eyes are different.
Right. So this relies on what? The curvature of the lens.
Yeah,
so when they design the lenses, they will design differently because we just behave differently.
Yeah, like first thing, like what Mr. Woon mentioned just now, lifestyle. Lifestyle for Asian spectacle wearer compared to European, it can be very different. So as we know, European lifestyle, they will be more tend to outdoor compared to Asian. We are more stick to our indoor activities. And second, face features, like nose, your vertex distance between the eyes and the lenses.
Right.
And we tend to be more short-sighted compared to our European counterparts.
Right. So between me and you, there'll be a problem of nasal septum that also varies with Asians. So these things are also taken into context. Very interesting indeed. Now, we've got a couple of minutes left. What would be your parting advice? You know, you're always coming on TV and radio to create awareness about doing the right thing with regards to getting proper lenses and, of course, contact lenses. What's your advice this time around?
So the first thing, I've said this number of times, would be number one.
Once again,
visit your optometrist every year, yearly. Get a comprehensive eye examination. That's one. Get good products. I mean, in terms of lenses, contact lenses, and so on, reputable products. Get them fitted in properly, and consider lifestyle. Because number one, you know, be active, go out and play. You know, expose yourself to the sun. Number two, tend to blink more. You know, take breaks from your digital devices. Every 20 minutes, rest 20 seconds, stare at 20 feet away. Yeah.
Stare 20 feet away. So
at least 20 feet.
Right. So every 20 minutes, I'm reading something. I just put my book down and stare at something 20 feet away. Like, you know, if I look at my friend here, the cameraman, I will not be able to see for the rest of the day. So, you know, it is a bit painful looking at him. But that aside, what would be your advice to Malaysians about lens?
Okay, so for lenses, I think just now you brought an issue, which is a lot of people would thought that when they go to visit an optometrist, they will charge them a lot. The lenses are very expensive. So, as Mr. Woon mentioned just now, get the correct product and get the reputable product. So for authenticity check, like just now mentioned, some people will say, I don't know what lens I'm buying. Okay, so let's say for some company, actually they have some authenticity check website, a link for them. So when they purchase their lenses, they will get a warranty card. So on the warranty card, there will be a specific number. They just go to the website, they key in, then they will know are they getting the correct product or the authentic.
Very quickly, we've got about 30 seconds. A warranty card, what do we need to look for in a warranty card?
There is a number, it's called receiving number or order number. So you just refer to that number. It will be 8 to 9 digits.
Right, 8 to 9 digits. On that note, Zili, thank you very much. Woon, always a pleasure having you here. Hope to see you back in the studios again and to help us understand more about eyesight problems. It was great to speak to you guys again. Bye. Thanks.
Thank you.
That was Dr. Woon Seong, President of the Association of Malaysian Optometrists, and joining him in that interview was Chong Lee, the Commercial Development Manager for Malaysia Hoya Lens Syndicate at Berhad, talking about eye strain and technology with regards to eyeglasses. Now, the last few years have seen the Internet of Things, or IoT, grow from a theoretical concept to a major priority right here in Malaysia. And by 2020, apparently, there'll be just so many devices, will be just inundated with devices that cause problems to the eyes. Now, when we move with technology, we have to be careful of how we move with technology and if it's affecting our health. Well, I will take a short break and come back with more for you right here on Medical Today. Stay with us.
If you look around you, joy is pretty much everywhere. Your favorite TV shows, your best friends, your favorite selfie. See? Joy. Now try looking at them again with Hoya Sync 3. All the vibrant colors are now in full detail for a clearer focus on the moments that matter. At any angle, wherever you are, magnified, true to your needs. That's happiness without a strain, and it's yours for as long as you have it on sight. Because your eyes are not made for screens. Sync 3 lenses are Hoya, eye for detail.
Hello Malaysia and welcome back to Medical Today with me, Jared Ratnam. We just talked a little bit about eye strain, eyeglasses and technology moving forward. Coming back, we talk about cancer, the big C, something people don't want to talk about. It's the 4th leading cause of death in Malaysia, according to our specialists who are with me in the studio, in the flesh right now. We do have with us Dr. Aminudin Rahman. He's a consultant clinical and radiation oncologist from KPJ Damansara Specialist Hospital. And also joining us in the studio is Dr. Azura Deniel. She's a consultant clinical oncologist, KPJ Ampang Puteri Specialist Hospital. Thank you very much for joining us. It's a pleasure to have the both of you in the studio, but it's not a very nice subject to talk about. Now, when we talk about telling people they have cancer, I'm sure all of us, all of you had to do it for the first time. What was your experience like? We'll start with you, Doc.
Yeah, okay, thank you very much, Jared. I mean, it's a very pertinent question because obviously cancer is becoming very common in Malaysia and globally. Like you mentioned just now, is the 4th leading cause of death in Malaysia. So it is quite a devastating diagnosis for anyone, not just to the patient but also to the family. So obviously when we talk to the patient about the diagnosis, we have to do it very compassionately, caring. We do a lot of counselling. We explain to them that this is not a death sentence. Cancers are not supposed to be considered death sentences, depending on the type of cancer. Is there
psychology to doing this, to talking to people, in order to easing them into it, or to ease them into it, sorry? Yeah.
I think it's really hard. Even after so many years, I still find it difficult, and we have problems with the family as well. Sometimes they tell us not to tell the diagnosis to the patient. Well, the first time I would say I remember is during my training, where we want to break the bad news to the patient. What we try to do with the consultant is to get everybody in the support system to be there together, so that when we break the news, we don't just tell them you have cancer, but we also tell them that there are things that we can do to help them to go through the journey.
Right. Now we have younger doctors coming into the system, and when they come under your tutelage or training, when it comes to talking to a patient, what do you tell them? Especially with cancer care, when you teach younger people, the 101 of speaking to someone, what's your basic advice that you give them?
We have to talk to the patient and the family compassionately. I mean, we have to understand, especially in the Malaysian socio-cultural background, there's a lot of differences in cultural belief system between the races.
Right.
We are not so open like in the Western culture. So we have to speak to the patient and the family compassionately, and we have to understand their sensitivities. And like Dr. Azura mentioned just now, talking to the patient and family with compassion and counselling, a lot of support and giving them hope. Right. I think it's very important to give these patients hope that there is a cure for cancers, and it's not a death sentence. So these are some of the things that we touch upon during the initial consultation.
Yeah. Very interesting. Now let's just dial back a little bit and take a look at what the area of speciality the both of you have picked. So you are a radiation oncologist and you are an oncologist. What is the difference? Maybe you can start with your area of speciality, Dr. Azura.
Actually, I think both of us are clinical oncologists.
Yeah, right.
So clinical oncologists do both chemotherapy and radiotherapy.
Right.
There are other specialties under the medical side where they just do chemotherapy, and they are called the medical oncologists. So I think we do mostly chemo and radio.
So the work is very much the same.
Very similar.
Now, when we talk about cancer care / management, I mean, from 10 years ago and now, how much has that changed?
I mean, the oncology field has improved remarkably. That there's lots of new developments and discoveries. Nowadays, compared to 10, 20 years ago, we now understand the cancer at the molecular and the genetic level, where we can predict the responses to therapy based on certain genetic tests and all that. I mean, the field has come a long way, and lots of advances in this radiotherapy as well in terms of technology. Now you've got IMRT, IGRT, stereotactic radiosurgery, which we may touch upon later on.
Right.
In the field of drugs, we've got previously we only used to have chemotherapy, but nowadays we've got targeted therapy, immunotherapy, drugs that harnesses the immune system to target the cancer cells.
Right.
So lots of new developments, and it looks promising. So that is why, coming back to giving hope to the patient and the family, that there is a cure for cancer, even for advanced cancers where we cannot cure the patients. We can control the disease for as long as possible and convert it to be something like chronic illness like diabetes and hypertension. So these are some of the things which has happened in recent years in the field of oncology.
Right. Dr. Azura, coming back to you, when we talk about light at the end of the tunnel, do you see hope, in cancer treatment? Now, a lot of people say, when it comes to treatment, people just do it perfunctorily because they know, that the end result's not going to be good, but families still go through it. But of course, there are lots of success stories, isn't it?
Yeah, definitely there is hope. I would say that there's been an explosion in the developments of treatment for cancer. It's becoming more precise,
right.
And it's becoming more personalized. So very precise and personalized. So we also see the new treatment like immunotherapy, the use of our own immune system to treat cancer. And with this type of treatment, we do see long-term survivors.
Right. Dr. Aminudin, when you talk about radiation therapy as an option to cancer treatment, when do you suggest, how do you know that this person needs radiation therapy, or how do you give them options?
Okay, so radiotherapy is a very important component of the management of cancer. We as oncologists, we treat patients with the non-surgical treatment, radiation and chemotherapy with drugs. We also closely work with our surgical colleagues, the surgeons, like breast surgeons, colorectal surgeons, head and neck surgeons. And then usually in most cases, we will discuss with our colleagues about the optimal management of patients. So most cancers, these are the options of treatment: surgery, radiotherapy, and chemotherapy, either in sequence, combination, or alone. So it all depends on which type of cancer it is, what stage it is, the condition of the patient, the age, the performance status, fragility, and so forth.
Right. Dr. Azura, would you like to weigh in on this? I mean, we're talking about, what the options people have as treatments, and when you pick radiation therapy, why do you pick radiation therapy?
So I think most of the cancers now are being treated with multimodality. So many types of cancers do need multiple treatments, including surgery, chemotherapy, and radiotherapy. So radiotherapy is more targeted to a specific area. So for example, breast cancer, there is an area that you can actually treat. So those patients may require radiotherapy, or like rectal cancer, or brain cancer or lung cancer. So it depends on the stage and the need for the multimodality treatment.
Right. So when you talk about radiation, what are the benefits of radiotherapy?
Radiotherapy is a very effective form of a non-surgical form of treatment for cancer. I mean, like we've mentioned just now, we treat a lot of cancers with either surgery or radiation, but the advantage of radiation is we can preserve the organ at risk or that we're treating, and we can clear the cancer. Let's say, for example, cancer of the larynx, voice box cancer. Patient commonly presents with
mentioning that to me.
Hoarseness of voice and
yes,
patient commonly present with hoarseness of voice, and it does affect the function of the voice box. So obviously, one option is surgery, but if the patient undergoes surgery, either part of the larynx is removed or the whole of the voice box is removed, and that's it. Patient would have lost the voice, and we have to use artificial voice box and all that. On the other hand, we have this radiotherapy where we can treat the cancer, the voice box, and the cancer within it. We can clear the cancer, and also we can preserve the organ. Right. Meaning after the treatment, patient will have some side effects and all that, but after completing the treatment, once the cancer is cleared, we preserve the voice box, but we can clear the cancer. So that's the advantage of radiotherapy. We want to cure the patients from cancer. We want to preserve the organs at risk, and also we want to preserve the quality of life for the patients. The patient can go back to, the family and the career, and function normally.
It's interesting you mention quality of life simply because there's a lot of stories out there. You go to social media, there's a lot of shock, horror, and disbelief kind of stories that come along, saying that as soon as you opt for treatment in cancer treatment by big pharma, you are weakening the immune system. So many things are happening. Cells are dying. A lot of horror stories. What would you like to add in with regards to that, or dispel with regards to that?
Yeah. So actually, if you talk about the immune system, the cancer itself can cause weakened immune system, because the cancer may infiltrate into the bone marrow and cause the white blood cells that fight infections to be low.
So when it comes to the treatment, when you talk about treatment options, they say treatment options also will weaken your immune system. Yes. Is that a myth, or is there any truth in that?
There is truth in that. Yeah. So both types of treatment, chemotherapy and radiotherapy, can weaken the immune system. But usually there are ways to overcome this. So for each individual patient, usually we will tailor the treatment according to their weight and height and the need and the area that is irradiated if you use radiation. And there are also treatment to overcome very low immune system by giving booster injections to improve.
Now, when it comes to treatment, when you're talking about radio treatment, what does the patient experience during radio treatment?
Yeah, so radiotherapy again is a local treatment. So basically, if you're treating head and neck or breast or the pelvis for prostate cancer, for example, there's another, not many people know the option of radiotherapy for prostate cancer, again as an alternative to surgery, where we can preserve the organ and clear the cancer and maintain the quality of life. So basically, patients undergo a daily treatment Monday to Friday for several weeks. How many treatments exactly will depend on whether the treatment is curative or to cure the cancer, or palliative to just to control the disease for advanced cancer. And radiotherapy is using what we call mega voltage X-rays. Just to give you an idea, the X-rays that we use for CT scans or X-rays is kilovoltage. So these are mega voltage, deeply penetrating X-rays, which can penetrate deeply and can kill the cancer cells. Initially, the patient will not feel.
Doesn't sound like a lovely Sunday afternoon, no?
Yeah, so I mean, it does sound very mysterious or very scary, but to be honest, I mean, most patients will not feel anything initially, but after several weeks, they will have side effects.
Right.
So cancer treatments are different compared to treating other diseases, where the treatments itself will cause side effects, but most of these side effects, like for radiotherapy, are temporary, are easily manageable, and are reversible. So like I said, eventually we're going to cure the cancer, preserve the organ, patient will go back to the family and career as a normal person. Yeah.
When we talk about therapies, like you said, mentioned earlier on, Dr. Azura, there are many options with regards to therapy. Now, which type of therapy has the greatest impact on one's immune system?
So I think the most extreme form of chemotherapy and radiotherapy. So chemotherapy, there are types that we give high dose.
You just scare us with megawatts. So what's the extreme form now?
High dose chemotherapy, where it rapidly ablates the bone marrow. So when you give high dose chemotherapy, this is more for hematological malignancies, leukemias, lymphomas. By doing that, you actually need to replace the bone marrow by doing stem cell transplant, and you regenerate the bone marrow. And also with radiation, there's this form of total body irradiation, where you give radiation to the whole body, and that will also deplete the bone marrow. And it's usually used as a form of treatment. Right. Under controlled conditions.
So while convalescing, while getting, after treatment, once the treatment is over, can a person's life come back to normal? I think that's the more important question if you're talking about extreme radiotherapy.
Yeah, of course. I mean, the point of treating these cancer patients is to cure the cancer, and also, like I've mentioned just now, preserve the organ, maintain the quality of life. Patient goes back to the career, family, and society. So coming back to the myths in social media about cancer treatment in hospitals, I feel it is a misinformation in the modern age. Previously, we don't have information, but now we've got misinformation because of social media.
Too much information sometimes.
Too much, and also misinformation, especially with regards to cancer therapy. And all the treatments that we recommend are based on high level of evidence, where we compare with the previous treatment and we try to get the patients better outcomes. And most of these, the side, of course, a lot of these treatments for cancer in hospitals, they have some side effects, but again, it's limited, it's reversible. I feel a lot of people in Malaysia, especially, they want a fast and easy treatment for cancer. That is why they go for alternative therapies.
We're always looking for that one pill which will
cure exactly. So that's the problem. So and that kind of mentality is being promoted by this social media thing. So that's the challenge that we have at the moment, to educate the public, to educate society that our treatments are effective. Our treatments may have some side effects, but these are temporary and reversible and manageable.
Very interesting you say that. When you talk to patients and when you tell them about their options and what you plan to do, when you put together a treatment plan for them, do they say, look, I've done research on this study, and this is what it says? Do they counter-argue sometimes?
Yeah, of course. We get second opinions. We get patients with family members from abroad giving us all these opinions and all that. I mean, we are open to that, but I mean, we are also quite familiar with dealing with these kind of issues where we've got more, I mean, with social media, with the internet, patients are also, I mean, the plus point is patients are getting more educated, patients are knowing their options, like for prostate cancer, for example, it's not just surgery, there's radiotherapy and other options. So there are plus points from the information from the internet and social media. We're open to that, but of course we discuss the options and let the patient and family decide what they are comfortable with.
You heard the saying, no pain, no gain. Right?
Yeah.
So sometimes we do tell the patients, you have to endure this, but in the end you do gain something about it. Yeah.
Dr. Azura, here's something interesting. Like when treatments are ongoing and the immune system is breaking down, what are the signs and symptoms of an infection due to, say, a weak immunity or weak immune system? So
the symptoms of infection are mainly fever. It's usually fever, sometimes associated with chills and rigors. So fever is usually of a worry when the temperature goes beyond 38 degrees. But if you have a weakened immune system, you tend to have you tend to be very vulnerable to infection. So any cough and cold around the house, you tend to catch it early and you catch it very frequently. And sometimes the illness is also more prolonged compared to other people and needs stronger treatment to recover from it.
Okay, saying if you have a patient, and I'm opening this question to both of you, and this person already has NCDs, has health problems already, say diabetes mellitus, probably hypertensive, so on and so forth. So how do you deal with that and the cancer and a weak immune system?
So usually when they already have multiple comorbidity, elderly patients, we also have to take that into consideration in deciding the treatment for the patients. So we do try to give something that is more gentle to these patients. But if they do have the treatment and have infections, then they are more vulnerable. Then the threshold to admit them to hospital to give higher dose or more strong antibiotics is higher, and maybe they do need booster injections as well.
Right.
Obviously, just a take on that. I mean, we don't just treat the cancer. We treat the patient as a whole, and we consider the family and all that.
Right.
So the patients who are more fragile, elderly, and all that, we have to be a bit more gentle. I mean, there's a lot of myths saying that doctors give a lot of these treatments which cause a lot of side effects, and the patient becomes worse after the treatment compared to before. But nowadays, with all these new developments, drugs and new technologies and radiation, side effects are actually less, and we can actually treat even elderly patients. There's some study recently showing that using lower dose of chemotherapy for elderly patients gives a similar outcome to using a higher dose of chemotherapy. So basically, all these new developments are making a difference for the patient and the family members,
right?
In terms of controlling and curing the cancer.
Right. I don't know if this is the latest in mosquito net technology. What am I holding? What am I holding?
Yeah. Okay. Okay. So this is it's called a thermoplastic mask. Thermoplastic mask, meaning when it's hot, it's pliable, it's soft. Right. So we can shape it according to the patient's. Say in this is a head and neck area that we're treating with radiotherapy. So when it's cold, it becomes hard. This is actually used commonly for radiotherapy treatments, especially like head and neck area, where we keep the position of the patient in the same position, and we do these markings, and using CT scans and MRI, we can actually target the cancer, very precisely with
so I guess in what the both of you are saying, I guess we need to. I don't like blaming entities for this, but I think Hollywood, Bollywood, and Collywood, are to be blamed for the way they portray a cancer patient, and how the person goes through their life suffering, and it's not fun having being a person who's undergone cancer treatment, so on and so forth. Do you think what we see on TV is affecting the way we think about cancer treatment?
Yeah, to a certain extent, yes. But the other point that I would like to make is we are not talking about this cancer enough. Cancer awareness is still lacking in Malaysia. I mean, I train in the West, in Ireland, in Canada. The awareness about cancer is, people talk openly about cancer and cancer awareness. It's not a taboo, or it's not like a death sentence. But in Malaysia, that's still a problem.
Why do you think that is? I know people from my kampong who still goes and sees the bomo or
that's another problem. The what do you call that? The belief about alternative therapies is also very strong. I mean, there's a study from government hospital saying that 30% of cancer patients are lost from follow-up after diagnosis. That means they don't come back for follow-up treatment and so forth until later, once the cancer has progressed and it doesn't work. These alternative therapies doesn't work. So that's a problem. And then the other message that I would like to personally convey to the society, to the public society, is not just cancer prevention or prevention is better than cure. Early detection saves lives. A lot of these cancers can be detected early using examination by healthcare professionals, screening, and so forth. So once we detect the cancers early, like breast cancer, we can actually cure these cancers. So not just prevention is better than cure, but early detection saves lives. Right. How do we detect early? By going for screening for breast cancer, mammogram and ultrasound, for cervix cancer, pap smears, for colorectal cancer, colonoscopy. Even nowadays we're talking about lung cancer screening for smokers using a low-dose CT scan. So we have to be active in this kind of screening programs. And I understand that the government has also introduced some of these screening programs for the B40 group of people, right, which is very commendable. So it's not just prevention, it's better than cure, but early detection. So once we can detect early, we can cure the patients, we can try to change this kind of mindset. Right. So cancer is not a death sentence.
Doc, what's your... we'll have you let you have the last say in this, being the only thorn among the roses.
If you talk about quality of life, I actually have many patients who come to my clinic. They say, oh, my friends are all asking me, do I really have cancer? Because I look so well. I mean, I can still go to work, I can still go shopping. And there are also patients who refuse chemotherapy initially. And when they had to undergo chemotherapy because the disease relapsed, there are some who commented saying that, oh, I wish I had done it earlier because I'm quite okay undergoing the chemotherapy. So I think all these myths about all the side effects and all that is not true. So they should talk to this kind of people, right, who have undergone treatment.
It's interesting that you talk about cancer awareness. We don't talk about it. Until a couple of years ago, we now talk about mammograms and how important it is for women to go out there and get their mammograms done, or at least, do self-checking, stuff like that. We already started the conversation. But as of late, there's been a bit of a lull. Why do you think that is? We've got about 1.5 minutes more, very quickly. Dr. Amin?
Yeah, I mean, there's a very important point. We have to talk more about cancer. Cancer awareness is lacking in Malaysia. I mean, the most common thing that they were talking about is smoking for lung cancer. But we are also seeing passive smokers or second-hand smokers getting lung cancer, especially females. So cancer is common. So we need to talk about cancer awareness, cancer screening based on the specific cancers that I mentioned just now. And not just prevention is better than cure, but early detection saves lives. Cancers can be cured if detected early. Right. Okay, thank you.
I think awareness programs, October especially is Breast Cancer Month. So there are lots of efforts by the medical side to try and promote this breast cancer screening for people to come. So there are actually hospitals who give out mammogram vouchers for them to come and do free mammograms. So probably in October you'll hear more about this.
Right.
Yeah.
On that note, we'd like to thank Dr. Aminudin Rahman and Dr. Azura Deniel, one from KPJ Damansara Specialist Hospital and the other from KPJ Ampang Puteri Specialist Hospital, joining us right here on Medical Today to talk about cancer care, management and also weak immune system. I hope you've gleaned a lot of information from this conversation. We'll take a short break and come back with more for you right here on Medical Today. Stay with us.
If you look around you, joy is pretty much everywhere. Your favorite TV shows, your best friends, your favorite selfie. See? Joy. Now try looking at them again with Hoya Sync 3. All the vibrant colors are now in full detail for a clearer focus on the moments that matter. At any angle, wherever you are, magnified, true to your needs. That's happiness without a strain, and it's yours for as long as you have it on sight. Because your eyes are not made for screens. Sync 3 lenses are Hoya, eye for detail.
Welcome back to Medical Today, the final segment. As always, in season 3.0, we have a video for you talking about first aid mistakes. Now, whether to use heat or ice is always the big question when it comes to an injury. And most of the time in Malaysia, we're always using heat for any injury that we have. But there is a problem with that. You need to know what you're using heat for, and you need to know when to use ice. So most of the time, if you're not sure, they say use ice, but don't take what I say as the gospel truth. Let's take a look at this video about the mistake putting heat on a sprain or a fracture right here on Medical Today. Let's take a look at that video.
The mistake: putting heat on a sprain or fracture. Heat can be soothing for aches and pains, but you shouldn't apply heat to a sprain or fracture. This will worsen inflammation. Ice helps decrease swelling, whereas heat boosts blood flow, which can make swelling worse. Save heat for issues like back spasms. What to do? You can apply ice or an ice pack for about 20 minutes. To make an ice pack, put ice cubes in a plastic bag that seals at the top. Wrap the bag in a clean, thin towel or cloth to protect your skin. Never put ice or an ice pack directly on the skin. Use the RISE treatment of rest, ice, compression, and elevation for the first 24 hours. But do consult with your doctor as soon as possible to get medical treatment immediately.
Well, always remember this, RISE. As an acronym, all you need to remember is rest, ice, compression, elevation, and never forget, if you don't know what you're doing, call or dial 999 first. On that note, before we end the show, very big congratulations, or hearty congratulations to our 3 winners of episode 1 who took part in the quiz. The answer for that episode was Shah Zara Khan, and the winners are Shariza binti Sharifuddin, congratulations to you. Mr. Arthur Freeman, congratulations to you. And Gauri Govindasamy, congratulations to you. We will be getting in touch with you for your prize as well. The respective doctors from the KPJ hospital will get in touch with you soon. Now, if you do have any questions for us, do send us an email. Send it to ask@medicaltoday.my, and we'll get the doctors or the specialists to reply to them. Or if you'd like to have someone on the show, please get in touch with us. Once again, all you need to do is send us an email. Send it to ask@medicaltoday.my. And don't forget, in episode 4, we'll be speaking to Dr. Ahmad Shukri from KPJ Damansara Specialist Hospital. He'll be talking about endoscopy procedures. Endoscopy is purposeful and preventable. What's all that mean? Well, we'll tell you in episode 4 of Medical Today. On that note, I'm Jared Ratnam signing off. You have a fantastic weekend and a great week ahead. Bye-bye. See you next week.
If you look around you, joy is pretty much everywhere. Your favorite TV shows, your best friends, your favorite selfie. See? Joy. Now try looking at them again with Hoya Sync 3. All the vibrant colors are now in full detail for a clearer focus on the moments that matter. At any angle, wherever you are, magnified, true to your needs. That's happiness without a strain, and it's yours for as long as you have it on sight. Because your eyes are not made for screens. Sync 3 lenses are Hoya, eye for detail.